Hi, I'm Jerry Deshane. Welcome to what we call the local perspective. We try to make it very real here on the local perspective, so today I came down with the flu so we could talk about public health. And little did I realize that my guest, who is a public health services director, did the same thing. So we're really dedicated to you. Seriously, this month's issue of the magazine talks about community health, whether that's the latest flu that's going around, the Zika virus, West Nile virus, lead in our water supplies, all of these things that are occurring in our environment. Who's watching out for that? To all of us, health is a very personal thing, but there's a community element to it. My guest is Ann Christiansen. Ann is the director of the Northshore Health Department.
Correct. Yep.
Good morning or
morning.
afternoon. This runs at different times.
Sure.
Thank you for being here. And I hope are you on the upside of this thing or on the downside?
Both I am on the upside as well as the community is on the upside. The CDC reported recently that the flu is peaked and it's now on its way down. We'll have a couple more weeks of this, but largely it's reached its peak.
Okay, now I'm blaming my granddaughter. She's sort of the epicenter.
Sure.
Is that where it all started? The little girl,
Your
3-year-old?
granddaughter?
Yeah.
I'm not sure of your granddaughter solely, but it is certainly something that happens amongst kids. Younger kids and older adults are the ones that are most vulnerable to viruses like the flu.
Okay. Well, one of the public health, community health, it's one of those things that local governments do. In Wisconsin, and there are 86 community health departments?
Right.
Yours is a little different. Most of them are with the county.
Yeah.
There are some with the city, but North Shore, describe it for me.
Sure. So we are located in northern Milwaukee County, and we are a sub-county multi-jurisdictional health department. So you're right, we're unique in that we're not county-based, but we are a consolidation of 7 communities in northern Milwaukee County. And that consolidation took place in 2011, 2012 is when it was implemented.
So what's your mission? What do you do on a day-to-day basis?
So public health in general, whether it's our department or any of the other agencies across the state, are there to promote and protect the public's health. Broadly defined, we have state statutory functions as well as we're engaged in all aspects of understanding preventable disease and disability in communities and working to prevent and to optimize health and quality of life. It's a very broad mission.
So this thing I've got in my head and chest, was this preventable? Could I have avoided this?
Yes and no. So in terms of what we recommend for people, certainly in the fall, is to get that flu shot because that has shown to make a difference. Now there's discussion about whether this year's flu shot has made a difference or not. So in any given year, it may or may not be as effective, but what we're seeing in our data is while it's not 100% effective, it is certainly effective at reducing the severity of flu illness. So that's certainly one thing that people can do right off the bat to prevent the illnesses that we may have right now. However, there are some basics that people oftentimes forget, and one of those is hand washing. That is a strategy that's very simple to do and can prevent a lot of illness out there. And then staying home being another one. If you're sick or have the symptoms of flu or other, we see a lot of gastrointestinal illness, so stomach-related illnesses, and staying at home and keeping yourself well and getting better at home versus pushing through and going to work or school with those symptoms. That will really minimize the extent of a situation where we have what we call an outbreak.
There's a lot of things I want to get into and talk about, but since we're on the subject, isn't that whole notion of if you're sick, stay home, it's sort of counter-cultural with us, isn't it? I mean, it's, we power through, we'll go to work, I can do it.
Right.
And yet all we really accomplish is we take out half the office, right?
Exactly. So one of our roles is to inform employers, not necessarily for the flu, but for certain conditions, if people do need to stay home, our job is to enforce those orders that people need to stay home until the symptoms that they have either been shown to be resolved with a test or resolved symptomatically. So again, in certain conditions, that's one of the roles that we play.
Okay. So what leads a person into this? I mean, you've got a medical background, obviously. You were with the medical college, you were with the University of Wisconsin. What
Yeah.
draws you to this field?
So my background is actually more social science than clinical in that my undergraduate degree is in psychology, and then what I was looking for after that in a career is something that was much more applied research based. And so public health, now this was 20 plus years ago, and a very different environment in Wisconsin that is important to kind of talk historically about, but wanted something that focused on health and applied research. And so public health kind of fit that area, or that interest of mine. And so there were no public health schools in Wisconsin. There was really no place to go here locally. So I ended up at the University of Michigan. And they have an excellent school of public health there, and did my graduate work there. And then came back to Wisconsin, with my newly minted degree, and there were very few jobs for someone without a clinical background, but with a master's in public health. So, trying the local government route, there were very few positions that were available to me. Most of those positions had a requirement for a nursing degree at a bare minimum. So ended up in academia, worked at the University of Wisconsin-Madison for Patrick Remington, who's kind of one of the large known figures in public health in Wisconsin. Sure. And we talked earlier about my work started with the tobacco control program over there when in the late 1990s, when the state was really focusing on its tobacco control efforts and the indoor air policies that were being implemented at the time. So that's where my career started, and ended up staying in academia for quite a while.
It's kind of a weird bit of trivia, but at the League, we're 120 years old. And I was looking back, one of the first women who was elected to a local public office was the Oshkosh city nurse. Oh. And for some strange reason, that was why you'd want that to be an elected official. I'm not sure, but was that the mindset, even as recently as 20 years ago, that you're basically the city nurse?
For the most part, and really as we look at public health in Wisconsin, it's very specifically over the past 20, 25 years, it's really changing, but it's both Wisconsin as well as nationally where we see these trends happening of the public health department's role. And actually CDC has kind of coined this as 3 phases of public health. So we had public health 1.0 is what they call it in the very early part of the 20th century, where the focus was on sanitation and really understanding infectious disease, promoting vaccinations. And then we had public health 2.0 in the late kind of 80s and 90s, where the focus turned more to kind of what we're seeing a little bit now, but chronic disease. And now we're in much more of a broader phase of public health with the passage of the Affordable Care Act, and really understanding what our role is as people become more well insured. Our role offering clinical services is lower and lessened over time, but our role in really being that, and I talk in the article about this community health strategist, of really understanding what are the conditions that are driving health in a community. That's where our role is evolving in this 3.0 phase of public health.
And how recent is the 3.0 phase?
It's quite recent, I would say within the last 5 years.
Okay.
Yeah, Robert Wood Johnson with their county health rankings really is driving a lot of this focus on that. Health is driven by much more than just access to clinical care and quality of clinical care. We talk about that being about 20% of what drives health outcomes. And we know the contributors of health behaviors are great, especially tobacco being one of those. That's been on the public's mindset for a long time. But other health behaviors like wearing a seatbelt or not excessively drinking, those type of health behaviors that individuals perform on a day-to-day basis contribute to health, maybe about 30%. The other drivers of health are really these social and economic conditions that people live in that contribute to their health. So can people walk in their communities? Do people have access to education and economic income that really can allow them to live optimally healthy lives? And then the physical environment playing a role in one's health as well. And so public health really understands all of those entities working together And that's where we play kind of a unique role in understanding in each of our communities how those entities work together and where we can leverage change in any of those.
Great. My guest is Ann Christiansen. She's the health director for the Northshore Health Department. I forget the title you used. It's a sub-county health department. We're talking about public health. And Ann, you talk about issues that basically would have you involved in everything from do you smoke, do you drink, what are your personal health factors, to local zoning, how are streets laid out, is it a walkable community? That's a huge waterfront.
Right.
How do you pick your battles? How do you decide, well, it's Monday, March, whatever,
Sure.
we're going to work on this?
Right. Great question. So in any given day, there are things that we have to do. They're driven by state statute. So communicable disease investigations, prevention and control being really one of the basic functions that we serve. So those are the things that really we're doing every day. And then there are things that happen that are focused on community health assessment and community health improvement plans. And I'll talk about what those mean in a minute. And those drive the priorities for the other elements of what we do. So yes, we could focus on everything and be very broad, but not very deep on any specific issue. But where the priorities come from should and is more and more driven by what the community is interested in. So as an example, where I am, pedestrian safety becoming one of those issues that parents, teachers, schools, the residents are really caring about. So we've got an initiative happening right now in Shorewood where we're looking at modifications around some of the schools to reduce excessive speeds, traffic, so people are being mindful of school zones. So what can we do focusing on this specific issue, knowing that there are 100 other issues that we could be tackling, but this is the issue the community is asking us to address and to be part of a team of people that can address the issue. So we don't do this alone. That's the other thing to make note of. We work in partnership with other groups, be they other government agencies. For example, in the case of the Shorewood pedestrian safety, we work with the Department of Public Works, we work with the village government leaders, we work with Safe Kids as a coalition in the region focusing on injury prevention. So we're working with partners, again, to prioritize the issues, but also to prioritize what are the interventions that we're going to do to make a difference. So yes, we could tackle very many issues, but we really try to focus on, again, what those community priorities are.
And that's, I guess, to me, that was unexpected. When we talk, when I read your article, which, by the way, excellent article on what public health departments do in the March issue of the Municipality, you get the sense that at the federal level is where these sort of big picture priorities are set. But do you actually get into, at the local level, let's make a plan for the North Shore communities? Sure. So basically there's more buy-in at the local level?
Exactly.
What does that process look like?
So it looks similar and different no matter which community you're in Wisconsin, but we're charged with starting with a health assessment, which looks broadly at we collect a lot of data. So what are the data that tell us what the areas of or what the health issues are in the community. So for example, we in our community use that county health rankings model, which I just talked about, of what are the health behaviors. So how many people, what's the percent of the population that smokes? What's the percent of the youth population that smokes? What's the percent of the population that drinks excessively, 5 or more drinks at a time? So we look at all of the data that we can pull together, and then we share that with the community, and we have a discussion with the community about, okay, these are the health conditions, this is where we might be doing better than the state or our peer communities, this is maybe where we're doing worse. And then we have a conversation about what those priorities are, and we pool that together and say, okay, what are the top priorities? It could be 3, it could be 5, and then we work to create a plan, again, as I mentioned, partnerships with those partners to create a comprehensive plan to address the issue. Now, the health department could lead some of those initiatives, but we may not. There may be other groups that are in a better position to lead initiatives. Another example is we work with a coalition or an agency called RedGen in the northern Milwaukee County area, and they're focusing on mental health issues, really trying to go upstream, looking at wellness, coping for kids, redefining success for youth so that there's less pressure for academic success on youth. So this is an area we know our communities are interested in. A lot of communities around Wisconsin are focusing on, mental health, broadly defined issues, because we know suicides are up in a lot of communities. We know that kids are turning to substances, be it alcohol and drugs, to help with their coping strategies. So we're not necessarily going to lead those initiatives because we have a group like RedGen who is in a position to do that. However, we're going to be a supportive team member. We're going to be part of their leadership group that's focusing on this issue. But again, we're not necessarily the ones leading the initiative. So that's how it can work in many communities. Health departments can take a lead, or health departments can be part of a broader team where another agency or an individual is a leader.
So you talk to your peers around the state, with their 80-some local health departments. Are the issues the same wherever you go?
No, not necessarily. You see and hear a lot of common themes. Again, the ones that are coming up right now, I mentioned mental health is a top concern for a lot of communities. Certainly opioids, which we haven't talked about, but I would put that in a category of broader substances, alcohol and drugs being a topic that is on many communities' minds. But there are going to be local issues that are not going to be the same. You mentioned lead poisoning. I think that's an issue around the state for sure, but it's very much a concentrated issue in the southeastern region of Wisconsin right now, given the infrastructure and the age of our housing stock in this area compared to other communities. So that may not be picked up on by communities in, say, central or northern Wisconsin.
And let's want to talk about alcohol, want to talk about opioids, want to talk about lead. So let's start with lead. The league worked on legislation that would allow local utilities, water utilities, to use ratepayer funds to help replace some of the laterals out there. From a public health perspective, for decades, we've known these lead pipes are in our homes. Okay, this is not surprising. It was the way you built houses 75 years ago. From your perspective, is it safe to have those there? Should they be gone? Should they all be gone?
We look at lead poisoning and lead risk from a pretty broad perspective. So the laterals and replacing the laterals is one element of what is contributing to lead poisoning in a community or a specific community. Focusing solely on that will not in and of itself address the problem. Backing up to paint being really what we see as the driver of the cases of lead poisoning in our communities, certainly Northshore. So I think to focus on one specific lead risk area is not going to fully address the issue, because even replacing the laterals, you're going to still have many homes with lead fixtures inside the homes. And again, back to the lead paint being a really significant contributor, and not to discount soil outside the home can also have high levels of lead. So looking at all of those risk elements together, that's where we need to be much more comprehensive, going back to tobacco, where tobacco was quite comprehensive in looking at all of the different areas where we're getting exposed to lead and addressing those. So it's a broader issue than I think what we've been talking about recently. And I think it's critically important that we keep focused on the discussion about all of these risk elements, because one of the things that we're experiencing now is confusion amongst the public about what to do if they have, if they have risks. So as an example, we had somebody with a slightly elevated case of lead, so not between 5 and 10, and we went to the home to kind of check on conditions, and she was she had been told or heard through media to flush her faucet, so she had been collecting that water, boiling the water and using that as her water for the day. And that's a message that is not what anybody would recommend, because boiling water actually concentrates the lead, so she was actually creating the opposite problem. So I think as a region and as a state, we need to think about our messaging about lead. And what are the kind of key things that people can do and really work to alleviate the confusion that's out there right now. So just the messaging being, lead paint, and there's some simple things to do, but there are things that people need to do. So one of the places where we see poisoning are the windowsills, raising and lowering windows, if there's any renovation. So wet mopping windowsills makes a big difference. So the dust falls into the windowsill, and kids love to hang out there. And that's where they get a lot of exposure. Again, I'm talking specifically the communities that I work in, but I suspect, more broadly. So wet mopping those windowsills. In terms of water, flushing water so you get the coldest water, so you're pulling it from the main,
Right.
makes a difference. Using a filter if you're concerned, or if you're, if you've got an infant who's formula fed, using a filter that you change regularly, that's a message that's confusing for people too. Those filters have to be changed on a regular basis, and the filters have to be specific for lead removal. Again, that's a message that I think people are confused about, what filters work. If people are wanting and feeling the need for filters. So there are a lot of messages that I think have been confusing out there for people on the issue of lead poisoning.
And we could spend a lot of time
Yeah.
there, but there's a lot of things I want to check in with you on. Alcohol. I guess I sort of take it as a given that that's still pretty much our drug of choice in this country. Do you see, as a community health challenge, our attitudes toward alcohol improving, getting worse, not really changing at all? Where are we at?
That's a great question. I don't see a lot of change. So Wisconsin as a state has been a pretty alcohol-rich state for many years. We're still at the top of, indicators like percent of the population that binge drinks 5 or more drinks on any occasion. I don't see a lot of discussion around that happening at a state or local level because of sort of the, how ingrained alcohol is in our culture here in Wisconsin. There are places, though, La Crosse being a great role model and example for communities that are addressing the issue. They had a number of drownings in the river down there, and they put together a robust coalition 10 plus years ago to address the issue, and have made some great strides in their culture of risky drinking. Specifically, one of the things that they had been focusing on a few years ago is looking at their festivals, and looking at even things like the size of the glass offerings for people.
Sure.
And realizing, we can make a difference. We don't have to eliminate alcohol use, but we can make a difference if we just make glass sizes smaller for people, so that we're not filling 16 ounces, but we're filling 8 instead. So those are things that we can do that keep our culture of enjoying alcohol responsibly, but maybe being thoughtful about how much we provide people in any given serving or service time.
And is that an example, let's say for your peers, I don't want to put you on the spot
Sure.
directly, but is that an example where you have a little bit of push-pull with your community, and you have to, as the health advocate,
Right.
you have to advocate for responsible use, and without being the killjoy in the party.
Yeah.
And I speak from some experience
Sure.
with some of my own organizations. You can only push so far.
No doubt. But I think oftentimes it's just a matter of enlightening rather than pushing. So again, back to the serving size, when you bring that to people's attention, like, hey, why are we promoting 16-ounce glasses that have unlimited refills of beer? Can we think about an 8-ounce pour instead? Those are things that people come around to realizing, that really doesn't make that much difference for us in terms of the image and what we're trying to promote here. So we'll go along with that change. And that Another example, actually back to lacrosse, is they created a family zone for one of their festivals. So it's a non-alcoholic space for families to be. So that the whole environment doesn't have to necessarily be alcohol. You can carve out spaces where you're still having the fun and still having the event, but it's not all driven by alcohol, as an example. But you're right, it's a push and a pull between kind of what we accept as norm and what we would want to see differently.
Sort of our aspirations and
Right.
yeah. My guest is Christiansen here on the Local Perspective, talking about community health, public health. Opiates, did that one sort of catch you by surprise, or did you see that coming as a public health threat?
Again, I always give a both answer. So I worked for many years at the Injury Research Center at the medical college, so kind of keeping our finger on what are the injury-related issues that are rising up. So we've been focusing on the leading causes of injury, so falls, motor vehicle crashes for many years, then falls. And then we started to see the rise in poisoning-related fatalities, and I would say that was everything's 10 years ago. So about 10 years ago, where we started to see this shift and these indicators that are changing. And so that's my first kind of moment of seeing there's something going on here. And then as more we look in the data about what are those poisonings, what are contributing to those fatalities, and seeing that they're being driven by, prescription medications, heroin, morphine. Those are the poisonings then that were contributing to those fatalities. So on a data level, we started to see it, and then kind of experiencing it much more in the community as a surprise of, this is why these deaths are happening. It's because people are overdosing on these substances. So I think it kind of started slowly with the access to opioid prescription medications, and then has kind of snowballed as people have become addicted to those, seeking other drugs in other places, cheaper drugs, and having to go on the street for those. And drug dealers are not always forthcoming about what they're providing you, and so we're seeing heroin and other illegal substances laced with all sorts of products, fentanyl being the one right now that's really contributing to the fatality rates that we're seeing.
So when I get together with mayors and village presidents, when they start talking about this crisis, there's not despair, but no one's found the silver bullet.
Right.
What are some strategies at a community level work for awareness, for actually reducing the amount of abuse that's taking place?
Well, it really starts again in partnership with the providers, and the prescribing habits of providers need to change, so that instead of getting 30 pills in a root canal or some oral surgery, you're getting the few that you need, so that there's not excessive medications. And police departments around this area have really stepped up to be places where people can deposit their excess medications. So that's one kind of easy fix. Let's get the medications out of the home so that people who are addicted, be they youth or older adults, middle working age adults, aren't having free access to those medications. So that's one kind of immediate thing to do. Second would be to look at, and we've been talking a lot about mental health, but mental health services, addiction services for people who are finding themselves addicted to these medicines, and before they move on to the illicit substances. So let's get them into treatment so that people can wean off of the substances and again, not end up with the illicit substances. So those are two kind of elements that we can do. But if you recall, drug use as a topic has been a challenge for public health for many years. And this challenge, while the lethality of it is certainly there, but the challenges are still there. And they go back to what I mentioned earlier of why are people initiating drug use in the first place? Obviously experimentation for youth, but then those substances give people feelings, they create addiction. So it's important to go back to the prevention strategies in the first place. And as I mentioned, wellness and stress and coping, and having people understand the elements in their lives that they're struggling with, so that they can make choices that are different than going to alcohol and drugs for that relief.
Great, and we've run out of time.
All right.
Ann, thank you very much
Sure.
for being here.
Yeah.
Ann Christiansen is the director of Northshore Public Health Department, talking about community health. I want to thank the West Allis Community Media Station, John and Dave behind the cameras, also Wisconsin Community Media. This is The Local Perspective, and I'm Jerry Gashane. Have a great day.